Even the placing, she's an expert.
morning, sir.
She's very cool.
Good morning, sir.
Brilliant. She's an expert. Even her placing was good. No, her placing was wonderful.
Following morning, being the 4th of May. So eventually it was on a Thursday morning. So I came back here. So they performed very well. They gave me 3 both hands. Then my baby came out successfully, and it was actually the first child delivered here. That is how it came out.
Did you pay any amount for this?
No, right from the day I registered here, I did not register with money. The registration was free. Even after delivering, it was free. They did not ask us to pay money. They all just that they asked us to carry our child and go. That is under health.
I am happier because I am surrounded by quadruplets. It means a whole lot to us. We have seen the first child that was delivered here in this center, and then we're seeing these quadruplets who are here for their routine immunization. And you know, when you talk about this electioneering period, this quadruplets gives us the next 4 years of His Excellency the Governor, the single Senator Hope Uzodimma. And I'm carrying this child alongside, staying beside the mother and the aunties and the siblings, to say that we are happy for what God is doing to us in Imo State. We are Igbos. 4 means a whole lot. It means the 4 market days of the Igbo land. And this is truly source of blessing to us. So we thank God for what has happened here today and what we've seen. And we wish the babies a good sojourn on earth.
Just get busy with one thing or the other there on your system.
Well, thank you very much for the question. Let me start with the visit we've just returned from. This is the first quarter monitoring and evaluation visit to the facilities that are implementing the Basic Healthcare Provision Fund, which is in line with His Excellency Distinguished Senator Hope Uzodimma's health insurance policy for Imo State. You know, we've implemented for 3 months, and it's important that we visit the facilities to ensure that the end users, the beneficiaries, are actually having the needed services, and what we are getting as data that comes from the facilities actually what is on ground. So my team just returned from Okigwe zone. We visited Obowo and we visited Ehimembano. The story is the same and people are happy with the implementation. Yeah, thank you. We've had over 300 deliveries across the state so far. We've not had any major issue in terms of insecurity at the PAC level. But be that as it may, we are also making some arrangements, because part of the indicators we have developed is to ensure that people who have to sleep overnight at the facilities are also protected and secured. So there is some component of the KPIs we have developed, of which, as their funds begin to increase, they will get some money that they will use to engage the local security that will ensure that those who are rendering services and those who are benefiting from the services are protected. Imo was created in 1976. Almost 47 years down the line. This is the first time in the history of the state where people can access health services without suffering financial hardship. And this is something to celebrate, and we're all happy to be part of this history, and we're all happy to be part of this legacy project of His Excellency Distinguished Senator Hope Uzodinma. Our manpower is not enough, that's just the truth. But we have to take a step first, and we're gradually taking it to the next level. We intend to also get some OICs as their funds begin to increase, see how they can also recruit some retired midwives, some retired CHIOs who will help them in the implementation. Because what we noticed in some areas we've visited is the volume of utilization has gone up, and most of them are currently overworked, and that's not very good for health workers. Well, part of what we did for all providers that are implementing this program is to sign the first ever developed service level agreement in the state, which we developed here at the agency. This service level agreement was developed by a legal team that ensures that anybody who is part of us in the implementation of this program signs that agreement, and that agreement ensures that services will be rendered 24 hours and there won't be any interruption of services. If there are areas visited and the required workforce is not enough at the facility, that's one of the reasons why we are doing this monitoring and evaluation visits, to ensure if there are areas we've identified, we'll sit down in our boardroom and see how we can reform some policies also to checkmate those areas we've identified as problems. If you have programs and you're not monitoring them, you will not know when you are not successful in terms of the implementation. So this is a routine for us. It's not going to stop today. Next quarter, we're also going to be in the field to ensure that the compliance is up to expectation. All the people involved in the implementation, both the staff, including the enrollees, are eyes on them. Well, what I will say is what the people we visited have asked me to say. We have gone around the Okigwe zone. A team went to Olu zone. Another team in Owerri zone. The story is the same. People have asked us to thank the governor for this legacy project. And people have also asked us to tell the governor they're very grateful, they're very happy in the implementation of this program. They are not new to the state. For over 47 years, they have never seen this happen in the States, and they are very happy, they are very excited. In some of the communities we visited, the traditional rulers came out to welcome us. That shows the level of acceptance for the program, and they are very happy on the implementation of the program so far. So we are very grateful to His Excellency Distinguished Senator Hope Uzodinma for giving us this platform